Good day, everyone. I am Angela May Lainov, a student nurse from PLT College Incorporated. I will demonstrate the Gordon's 11 functional health patterns. What is Gordon's functional pattern? A method device used by nurses in the nursing process to provide a more comprehensive nursing assessment of the patient. Before we start the assessing of the patient, we must start to check the chart of the patient. What is medical chart? It is a complete record of a patient, key clinical data, and medical history, such as demographics, vital signs, diagnosis, medication, and laboratory and test results. Next is to wash my hands and do my proper hygiene. Nurses need to wash their hands not only to prevent them from getting sick, but to protect their patients from acquiring healthcare associated infection. Good day, ma'am. I am Angela Melaina, your practitioner nurse for today. Before we start, I just asking a few questions before we start about your backgrounds, your past health histories. So, kung comfortable ka sa mga sinasabi ko, just let me know, okay?
Okay.
Okay, ma'am. So, what is your name, ma'am?
Aaron Carmela po.
Your birthday?
June 29, 2006.
Address?
Kirang Aitang Nalabiskan.
Your place? Kung saan ka nakatira ngayon?
Nga,
Current.
Kirang Aridao Parang.
How old are you?
40.
What is your work? Are you a student or...
Student pa lang.
So, ma'am, huwag ka pang mag-alala sa mga background na about information na nakakuha namin about sa'yo. Kasi, hindi to lalabas kung kani-kanino man. Unless, may mga ibang health workers na kukuha nito para i-check yung data mo. It's okay for you?
It's okay po.
Okay. So, let's start about your health perception and management. Then, do you have any past health history?
Yes.
What is it?
Surgery of appendicitis.
Okay. Your present condition now, ano yung mga nararamdaman mo ngayon?
Stress due to online class workload.
Okay. Are you taking any medication?
None.
Have you had any accident injury?
Wala po.
Okay. So, let's move on to nutritional metabolic pattern. So, it is focused on the pattern of food and fluid consumptions relative to metabolic need. So, what is your diet mean?
Nutritious foods and fruits.
How many times a day do you take or kung ilang beses sa isang araw ka kumakain?
2 to 3 times a day.
So, any food restriction? Like, kung ano ba yung mga pinagbabawal sa'yo ng mga
Guavas and seasoning ng mga
Can I get your weight? What is your weight?
37,
Your height?
42.
in your past blood pressure?
120/80.
So, let's move on to elimination pattern.
Data collection is focused on excretory patterns, bowel, bladder,
Sa
and skin.
pagtatay mo, ilang beses ka sa isang araw tumatay?
At least 2 to 3 times a day.
To your menstruation and urination, may mga nararamdaman ka ba? Or what?
Wala naman po kasi regular naman.
And to your activity and exercise pattern,
Assessment is focused on the activities of daily living requiring energy expenditure, including self-care, exercise, and leisure activities.
do you have any breathing problem?
Pag napapagod po.
Do you have cough?
No.
Any changes in heartbeat during exercise?
Pag napapagod po is nahihirapan ako huminga.
Like bumibilis, ganon?
Mabilis yung heartbeat pero mahirap huminga.
What type of exercise do you do?
Basic exercises.
So, let's go for your cognitive perception pattern. So,
It is focused on the ability to apprehend and use information and on the sensory functions. Data pertaining to neurologic functions
are
are
you good in
collected to
sensory
aid
and
this process.
auditory advocacy? Yes or no?
Yes.
Any difficulty in sentence making sa mga paggawa mo ng mga sentence?
Paggawa ng essay, nahihirapan ako.
Hindi ka nakaka-construct ng mga words like that?
Yes. Tapos, madaling makalimot.
So this, are you experience loss of memory?
Yes.
So let's move on to your sleep and rest pattern.
It is focused on the person's sleep, rest, and relaxation practices. Dysfunctional sleep patterns, fatigues, and responses to sleep deprivation may be identified.
How many hours ka natutulog?
5 to 6 hours.
What do you feel after waking? Bago ka gumising? Or pagkagising mo, I mean?
Minsan, nahihilo and masakit yung ulo.
Are you using any medications for sleeping?
None.
So to your self-perception and self-concept pattern.
Focused on the person's attitudes towards self, including identity, body image, and self-worth.
So, what is your self-perception about yourself?
Helpful and soft-hearted.
Are you satisfied with your self-body image?
Yes, I accept my flaws.
So, do you like grooming?
Yes, kasi wala namang taong hindi gusto mag-groom, di ba?
Yes. Of course. So, to your relationship and roles pattern.
Focused on the person's roles in the world and relationship with others, satisfaction with role strains, or dysfunctional
So, if you are in
relationship may
hospital, then
further
who will perform
evaluate.
your responsibilities?
My cousin.
So, your cousin.
Yes.
All the family members are cooperative with you?
Yes.
Who is decision maker in your family?
Cousin.
Can I ask you some questions? Bakit yung cousin mo?
Kasi doon na ako nakatira.
Where's your dad and your mom?
My mother passed away 3 years from now.
Okay.
And my father is singer.
Okay. So to your sexuality and reproduction.
Focus on person satisfaction or dissatisfaction with sexuality patterns and
So,
reproductive
when you
function.
first notice changes in your mens?
13 years of age when it started.
Okay. Do you have any sexual problem? Active sex. Are you active in sex like that?
No.
So your coping and stress tolerance pattern.
Focus on the person's perception of stress and his or her coping strategies. The effectiveness of a person's coping strategies in terms of stress
So
tolerance
if you
may
have stress, then
further
what do you do? What
evaluated.
is your coping mechanism towards stress? Paano mo siya nalalagpasan or paano mo siya ini-express through your feelings?
Crying and nagagalit.
Okay. So, lastly, your values and belief pattern.
Focus on the person's values and beliefs or on the goals that guide his or her choices or
What is your
decisions.
religion?
Roman Catholic.
Do you offer some prayers?
Yes.
What is your plans in life?
To become a successful teacher.
So, do you have any questions and clarifications about the
None.
Okay, so that will be all. Thank you and for your time. Thank you sa pagbibigay mo ng oras para magbigay ng information about sa mga natanong ko sa iyo. And this data is, I'll be forwarding this data to your doctor and we'll see how we proceed, how we are proceed.
Okay.
So thank you for cooperating.
You're welcome.